Insurance isn't one size fits all. That's why customers have enjoyed Progressive's Name Your Price tool for years now. With the Name Your Price tool, you tell them what you want to pay, and they'll show you options that fit your budget. So whether you're picking out your first policy or just looking for something that works better for you and your family, they make it easy to see your options. Visit Progressive.com. Find a rate that works for you with the Name Your Price tool. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law.
This week on the episode, we have a doctor!
Yes, and now listen, this is a great conversation that we have. There is a lot of COVID talk. You might be fatigued, but we had a really great time, and it's informative and interesting, and it wasn't just about COVID.
Also, stick around at the very end, and you can hear about a very specific sexual scenario in which a doctor says that two people can have sex that have never met.
During the time of COVID.
During the time of COVID. Well, that's what we're talking about. COVID. It involves a lot of sheets.
Yes, we are very happy to have James Simmons, Dr. James Simmons, nurse practitioner, back on the show with us for our 1 year checkup.
And in 1 year from now, as promised by Dipper on the podcast, he will be taking a rectal exam by Dr. James on a live show in a year.
Bye.
Forever Dog.
When your first choice is a big old bus,
you turn around and boom, you end up with us. Sloppy seconds. Oh, Diva. Our number is 213-536-9180. Our email is sloppysecondspod@gmail.com. Now on with the show! Are you ready for some sloppy second juice? Stupid little facts, you next little facts, you dirty little facts. It's Big Dipper and Meatball. We're going to talk to a doctor today. Ooh, a doctor. I'm Big Dipper and that's Meatball. We're going to talk to a doctor. Welcome to Sloppy Seconds with Big Dipper and Meatball, the doctor edition.
Before we start, Meatball, I think your audio levels are crazy high. Will, thoughts? Don't it sound like she's speaking?
The Mount Everest of peaking.
Not Mount Everest.
You didn't stop me at all.
Can you just go into your system preference? You know how we do this every time.
Yeah, but I just did it last time. Do I have to do this every time?
I don't know.
Is this what Big Sir has done to my computer?
Don't use my private bedroom name on the podcast. Don't call me Big
I
Sir.
Someone's got to have something for Big Sir there or something, right? So they call my ass
Big Sir.
Big Sir.
Okay. Well, thank you for that very blown out intro, but we are back in business.
Oh, yeah, blown out. Sounds like Willem.
Okay. We're so excited because at the beginning, a year ago, when we were first starting to record podcasts from home, if you recall, remember there were like 2 or 3 weeks where like no one had good internet because the internet wasn't used to everyone being at home on their computers.
Yeah.
And so
we hadn't fully figured out Zoom yet either. Oh, God.
Yeah. Did you just say you hadn't figured it out yet?
No, we hadn't figured it out either at that time.
Or at this time.
Maybe clearly, our guests will remember there is a certain episode of Sloppy Seconds that I am not on.
No, you're on part of it.
I'm not a part of the interview portion.
Therefore,
correct. I'm not on the episode.
So we had Dr. James Simmons on the show to talk about COVID last March. Wow. And now we've sort of figured out how we do our podcast, and Meatball was feeling left out. And so we wanted to have a 1 year checkup with Dr. James Simmons. Welcome to the show.
Thank you. It's like your annual. Checkup, right?
Our annual. Annual? How did you say that?
Well, I mean, you could say annual if you want. I mean, that was this weekend, but you could, annual works too.
Oh, okay. Mm-hmm. Well, so since we've talked, you've added a lot more letters to your name. Is that true?
You're no longer just the NP?
Oh, how about all of this madness? So I was in the middle of finishing my doctorate.
Okay.
When we talked last year. And so I finished in June. I successfully defended my dissertation and all my research and all my whatnot. So I now have officially a doctorate of nursing practice. So I'm still a nurse practitioner. I still do what I do, but I now have more letters behind my dumb name. So I am Dr. James Simmons now.
Which isn't
Ooh.
that the bullshit that some people go after the first lady? They're like, well, she doesn't know how to fix my broken arm, so I'm not calling her Dr. Biden. And you're like, you dummy. There are so many kinds of doctors. What's wrong with you?
Isn't that wild? I just thought it was so dumb. And that guy who wrote the article was calling her kiddo and all of these things. Like, right. You can have a doctorate of poetry and you're still doctor, right?
Yeah.
So, and I actually am referred to as Dr. Simmons where I work, but I'm always quick to clarify and make sure that people know that I am a nurse practitioner. So I'm not trying to pretend to be a physician, but also as a nurse practitioner with a doctorate, you're going to call me doctor because my name is Dr. James Simmons.
But yes, and also that's going to work very well when the gay bars open back up. Just be like, I'm a doctor.
Hey, doctor.
Well, what I love when I saved your phone number, there are so many, like the auto, like the way you have your contact in here.
Uh-huh.
It says James Simmons, and then it says DNP. What is that?
Doctor of Nurse
Practitioner.
Uh-huh.
MSN.
Masters of Science in Nursing.
Ooh.
RN.
Registered nurse.
AGACNP-BC.
Okay.
Adult gerontology acute care nurse practitioner board certified.
You said, do you know what I've done? I've gone to school, and I'm going to let you know I have these degrees.
All of those letters just start adding zeros. Those letters equal zeros to the amount of student loans that I have. So you see some fool with all the letters like I have, you know that they are in debt. Not just like I just bought a cute car and now I got a car note. No, debt, honey, like mortgage debt.
The
But
depth
that's all right.
of debt.
I'm here to help the kids. I went into debt to help the peoples.
Well, so that makes me think, Meatball, you would be like a really great candidate for
Nothing.
getting.
I ain't got no initials.
No, but for getting a doctorate in something, because as Dr. Simmons said, for certain degrees, the doctorate is you write your dissertation and then you defend it. And
I wanted to ask about the
You'd be good at
defending it, honey.
defending.
You had to go defend her. So what does that exactly mean? So what was your dissertation on?
So my work was on, and some people listening to this are going to be like, well, DNPs. So in the academic community, there's this whole argument.
No,
about,
our listeners are not smart. They
I
won't
know,
know.
No, yes,
not
they are.
smart.
They're
So,
mean.
Long story short, what I wrote was a dissertation, but some of the PhDs who might be listening might have some issue with that word, but whatever, it's a dissertation. And what I did my research and my work on and what I defended was about using Instagram as a tool to increase PrEP in young Black men who have sex with men.
Yes.
So and UCLA of all places was like, I want to use Instagram to get young Black men who have sex with men to learn more about PrEP. So they start taking it because that's the only community where HIV numbers are still going up, and everybody else's communities, HIV numbers are going down. And
Right.
UCLA was like, sounds great, have fun. And I was like, oh, they bought it. Shit. now I gotta
I love
do it.
UCLA. I've been there twice.
What for?
Oh, really?
Didn't I host like 2 parties there or something? Was that
I'm so
UCLA?
confused about the college system. We took you to one place, but I always thought UCLA was. Which one is the?
One's downtown.
And the other one
That's
is.
USC. USC.
No,
is
so we went to
downtown.
UCLA because we had to go to the nice part of town.
Right.
And it was,
Yeah.
let me tell you, I saw those kids and I got scared. I do not like being around youths. Okay. So what do you mean you had to defend it? So you had to go in afterwards and like present it?
Yeah, so there's the way it kind of works is you kind of have 2 defenses really. So you design this whole thing. You
took it
go
to
and
court.
You read all the research. You're right. You're like everyone who's ever studied Instagram, studied PrEP, studied how to change people's behaviors, studied Black men who have sex with men who are HIV negative, like CDC, all this stuff. I spent like a couple of years researching all that stuff. And then
Bibliography, honey.
Yes, and I put it all together. I think I had 97 sources that I cited. So you put it all together, and then you're like, look, all these people have done this stuff. I want to take everything that they've done and kind of put it all together and improve upon it. So I want to do this. I want to do this thing. And what I did is I created an Instagram page. I put out approved messaging about PrEP that was very, very directed to my target audience. I did it over 6 weeks. I DM'd them. I liked their stuff. I followed them like I was crazy, super active on Instagram. And then I surveyed them before and afterwards and said, okay, after this crazy person from this Instagram account blasted you with all this information about PrEP, did your attitudes about PrEP change from before to afterwards? And long story short, yes. The attitudes did change, but what was more important, I think what we learned was how to use Instagram to do something like this. So that was part of the issue, was the way that, and this was my fault. This is something that happens to everyone who does doctoral research. You learn the things that you did wrong, but you kind of don't learn it until afterwards.
Yeah, you have.
Of course. I mean, that's the case
fail.
with everything, right?
That's like right. So what I learned was that the way that I developed my survey didn't quite get at the question I was trying to answer, as a long story short. So afterwards, the people were like, yeah, this information is great. I loved learning about it on Instagram. I actually think that Instagram is a really great place. Yes, I want to consume this information on Instagram, but I need to consume it from somebody that I know. And which should not be a surprise to anybody, right?
Yeah, because that reinforces the idea of like an influencer, because people build an audience. They don't want to look at someone that they don't care about.
Yeah.
They want to,
It's something that you kept saying during it that I thought was interesting, was that you were saying black men that sleep with other men. You weren't saying gay men. You're saying this is targeted towards maybe people on what people like to call the down low.
The down low, the dirty
The
down
DL.
low. So, well, it's really interesting because there are, so, I am biracial. My dad is black. And
Join the club, baby!
hello, Miss Ma'am. That's right. We sisters. So what we know then, right, from the black community is that a lot of black men who sleep with men do not identify as gay, and they never will, right? They don't embrace the word. They don't. We are all very entrenched in the gay community, right? Big Dipper and I go way back to Chicago days and whatever. So we know, like, gay community, we kiki and we ho on Sundays, like all this kind of stuff, right? There are hundreds of thousands of black men who prefer to have sex with other men who will never be a part of that. And so what was really interesting to me was, like, all the drug companies and the public health departments were always targeting gays. And I'm like, wait a minute, but there's a big subset of black men who sleep with men who don't identify as gay. We got to get to those folks too, because they need to be on PrEP as well. Maybe Instagram is a way to do it.
And I think also a lot of people who don't sort of wear their sexuality on their sleeve also don't sort of like feel as comfortable walking, like every 3 months going and be like, I'm getting my STD checkup, or I'm doing, because it isn't so open in their world. And so there's more of a risk of, like, anything being spread because people are not, like, talking as much or getting tested as much in certain, situations.
I mean, what you just brought up there is this, I don't know if you've heard this fancy term yet through COVID in the last year, but social determinants of health, right? Like, if COVID has done anything, she showed us how racist the healthcare system is. In LA County, you're 3 times more likely, if you're a Black or Latinx, to get COVID-19. 4 to 5 times more likely to get it. You're 3 times more likely to die. And so when you talk about then black men who like to have sex with men who live in communities where there might only be one STD clinic. So what do you think is going to happen when someone in the community sees you walk into the STD clinic? And they're like, well, wait, what are you doing there, right? And so if you're only targeting STD clinics, if you're only providing information to this community where they have to go to the clinic to get it and be seen getting it, you're not going to get the information to people. Vis-a-vis, that's why rates of HIV in that community were still going up. But at least when I started my research, they have thankfully started to level off, but that's a whole different conversation.
So, but this is something interesting, because a lot of people, 2020 was a year where a lot of people's eyes were open to the idea of, like, systems of oppression, where people were not just looking at an individual case basis, but sort of like pushing beyond that. And, we scream and shout pretty much every week on this podcast, whether we like it or not, about people not wearing masks or not socially distancing or going to Puerto Vallarta.
We're getting into it.
But
I don't want to talk about COVID.
Days over COVID.
But the thing is we a lot of it goes, we go like, I can't believe that those people are all having a, like a party at their house and there's 25 of them and they're all just hanging out. We never take one step beyond that and go, what's the psychology behind why they think that's okay? What is everyone's past experience that leads them to believe no one cares if they get sick, or if they get sick they're going to be taken care of right away, or like whatever anyone's experience is. And I think that leads to like the larger conversation about like the healthcare system, which is, I was just looking about vaccines, and the statistics in LA County is that like 32% of all people who are vaccinated are white people. And, like the numbers of white people who are like scamming their way into a vaccine early or trying, to like game the system so they can get back to normal is much higher than other, like races in the survey group.
Yeah, it's pretty wild. And if you want to go to anywhere in the United States in particular where there are so distinct geographical, and Chicago is actually one of those places too.
Oh,
but
yeah.
Oh,
LA,
Houston is one too.
Absolutely. Houston, very much so. So, really, these big metropolises, if you will, you can see the haves and the have-nots. So my friends who have worked at the vaccine distribution site at the Forum, which is in Inglewood, which is primarily a Latin and Black neighborhood, most of the people who are getting the vaccine there are white. Driving Benzes and Teslas and Beamers, and their addresses were Westwood and Bel Air and West Hollywood. And so that's starting to change a little bit, but and a lot of these people were young. This was early on too. This was weeks ago, right? When they hadn't even opened it up. So a lot of these people were young. It was questionable, if they had, other health conditions or whatever, but for some reason they became eligible for this vaccine. They drove to the Black and brown neighborhoods where that vaccine site was specifically put to serve Black and brown communities, and still ends up serving rich white folks. And then we wonder why Black and brown people don't trust the healthcare system, right? And this just gets repeated over and over again, right? I work at two different hospitals, and I will not mention their names, but one of them is a very well-resourced, incredible hospital. It's fantastic. It's world-renowned. Most of the patient population is white. COVID was not as big of a deal there. You just, the rates of people dying just didn't really happen. The other hospital I work at primarily full-time is in the hood, where about 65 to 70% of my patient population are primarily Spanish-speaking, identify as Latin. A big percentage are undocumented. In that hospital, that's one of the ones where, I was on the news and they were calling and all this stuff about how we're overwhelmed. We're intubating people in the parking lot. That was one of the hospitals in LA County that had the freezer trucks because we'd run out of room in the morgue. Right. And so you drive 20 minutes in one direction, and all those horror stories of particularly December and January here in Los Angeles County we lived through, but then you drive 20 minutes back the other direction and everyone's like, I'm not really sure this COVID thing is like such a big deal, because like I just hang out in my backyard with all my friends and like we wear masks and I haven't really known anyone who's gotten sick or died. And that's where all the white folks went, right? And it was just so stark dealing with that. And having done my research on like race-based health disparities, essentially, right? And then seeing that live out was pretty wild.
So what is because something we've talked about, because we want to like talk about this vaccine scenario, because we heard, like obviously on the internet, a lot of people getting dragged for like I signed up for Uber Eats because for folks listening who are not in LA, they opened up delivery. So obviously it was healthcare workers first. It was people over 65. Then it became like secondary healthcare workers. Then it opened up to like delivery, and because they're trying to get the economy going, food service. So if you work at a restaurant.
So LA County right now is like at food service and delivery people and stuff. And then
teachers.
And teachers.
Yep.
And just like most essential care workers like that. But then next it's going to open up to entertainment, is what I just read, is that in 2 weeks they're opening up LA to do entertainment.
And so so there's two things to talk about. One, people gaming the system. Oh, I can sign up for Uber Eats as a driver, do one delivery, and then I'm eligible to get a vaccine. then additionally, I've talked to some friends who they're friendly with their doctor and they got a phone call and they were like, my friend's working on a site. They're going to throw away 60 vaccines. If you want one, drive down there. They're going to throw them away. And so people who have just like put their name on a list or told people who have access, they've gotten their way into a vaccine. And now there are websites where Meatball and I just looked at a website this morning and we signed up. Because if you fill out everything accurately and it says what's your age, what's your job, and you click entertainment, they give you an appointment. So those things, the appointment's in a couple weeks, but those things are now happening. But we're in a position where someone sent us the link and we can do that. That doesn't mean we work at a grocery store, and I'm sure there are people working at a grocery store who don't have access to that yet. So What is it? What is the fix? What is the workaround? We know so much is broken, but what are the ways that those things can at least take a step forward to get fixed?
Does this make us bad people?
Yeah, exactly.
No. So listen, I think that there are there's multiple things going on here. And I think one of the biggest...
I asked you 12 questions. So.
Right. No, that's okay.
Try to dissertate that.
Get on, right. Defend that. Yeah, I told you we're sisters, Meatball. Defend that. So, listen, part of what's going on now, I think it's important to differentiate between what went on a little bit earlier on, even just a few weeks ago. So, the administration change, the regime change, if you will, really, really did make a big difference. There was a vaccine distribution plan and strategy that was intentionally not executed. For whatever reason, we don't know why. So the previous president, who I've been trying to stop say his name, didn't allow this plan to play out as recommended by, and everyone likes to throw Fauci's name around. Fauci is an amazing, wonderful person. Like, I love him, but he is not in charge of everything, right?
Yeah.
So there were some people who had this plan put together. In fact, the Obama administration had a kind of a very loose vaccination plan. If something like this were to happen, they kind of took that as a blueprint, moved forward. There was a plan. It just wasn't really executed until January 23rd, right? When was inauguration? The 20th? So the 21st.
Yeah.
Right. So what we're now seeing, y'all being able to have a vaccine appointment in 2 weeks, because you're in the entertainment industry, is part of what this initial plan was supposed to be, when it should have started a month earlier in December, right? So we're getting to this point now where, with the addition of the Johnson & Johnson vaccine, Pfizer and Moderna also, there was some really complicated things about the numbers of vaccines that they had available. We weren't really being told what that true number was. And it's a really complicated story as to why. But now we actually have better insight into what they actually have and what they're actually able to produce. So you'll notice we're not hearing as many stories of these. Well, LA County was promised 348,000 doses this week and they got 12,000.
Right.
Or LA County was promised 348,000 doses and they got 600,000 because we got Phoenix's doses. You know what I mean? You're hearing less of that now, right? So we actually have a better handle on what is coming in from a supply standpoint. We're able to execute the plan. And frankly, as of the recording of this podcast, we're almost at 100 million shots in arms right now, which is fantastic, right? So we're actually, the fact that y'all in entertainment, which is the biggest business economic driver in our region. Right. So think about other regions, other parts of the country are doing things in their big economic drivers that require people to be near each other so that they can get their economies going back. So people might say, oh, is entertainment essential or whatever? Well, we're actually getting to the point now where in about 2 weeks, we probably had an opportunity to get at most of the quote essential workers. So now we can start doing things like helping individuals who need to be around each other to drive the economies back. Get them vaccinated, as well as other folks. Like what you're going to start seeing is like people who are 45 and older with comorbid conditions they're going to open this up for them. You're going to start seeing things like people with obesity, diabetes, hypertension, heart failure of any age.
Stop.
So, I mean, I could go on and on and on about this, but I think there's a difference between, no, y'all are not bad people at all, now getting this vaccine, I'm all for it. I'm all for everybody getting a vaccine.
Well, that was a big conversation we were having in the beginning, and my big thing, and I think you spoke to it, the first thing you said, which is, if we had different people in power, this would have all been sort of, there would have been a system in place much, much sooner.
Yeah.
But from the beginning, I was like, I don't understand why it's only a written card, why it's not a national digital database. I don't understand why there isn't like a wait list you can just sign up for at locations where if they, because if they do need to throw out the vaccine or they do have extra doses, that you just can't be on the wait list. Like, those are things that I don't understand, but I believe that had a real system been in place or had all of the binders of pandemic planning that a previous administration had prepared been at the ready, those things would have been easily accessible. And so I don't know. I'm under as long as I feel like we're not taking it from someone else. I feel like anyone who can get vaccinated should be able to get vaccinated, because pretty soon, I would say by next month, we're going to be in LA. The people who are not vaccinated are the people who don't care or don't want to.
Yes.
Isn't that a thing? And we are really close to that. I would say 6 weeks ago. Is that right? 6 weeks? That's pretty early. Even a month ago, maybe. I would have been like, okay, nope. Not time for y'all to get vaccinated, whatever. But this is how fast things are changing. I mean, we are putting we're almost I think we're roughly 2 million shots in arms a day in the country now. That is tremendous. That's awesome. So all these things you're talking about are progress forward. Now, I will say there have been instances, and there are people that I know who've had this sort of like, oops, the vaccine fell off the back of the truck and into my arm sort of situation. Right now, we don't want vaccines to go to waste. Right. So if there have been an opportunity to, you vaccinated everyone who has, so, 3 people didn't show up to their appointment, and then the next 3 people on that list get that vaccine on the list, get that vaccine. I'm all for it, because at the end of the day, the more people get vaccinated, the better, right? We get to herd immunity, and we slow down these variants, which scare me a little bit.
Oh, the variants scare me. Now tell me, what if one Moderna fell off a truck and ended up in my arm, and then I was like, for my second shot, I'll get a Pfizer. What happens? Do I get a little cocktail going in me? Is it a good time, or is that not a good idea?
You grow a third arm. No, we actually don't. We don't really know. It hasn't been studied. So because it hasn't been studied, we officially don't recommend that.
I was just kidding. Don't anyone do that, and I did not do that. But I just wanted to say cocktail.
Do I have a cocktail? I do tell people not to have a cocktail in the 48 hours after getting it, because
really?
That's gonna be hard for you.
That second one is a beast.
Wait, what? I thought some people had no reaction.
Some people don't. My reaction was
different.
Was fairly mild. I was really tired, and I had super brain fog. Like, I was just like staring at my husband, couldn't remember his name. Like, I was just like out of it. But my husband,
the bearded
on the
man
other
that
hand,
walked by a minute ago?
Did you see him in the mirror? Mm-hmm. He was also, pardon the audio early on, he decided now was the perfect time to make lunch. I don't know why. So
we can't hear him at all.
I was like, babe, I'm doing a thing, right? Anyway, so he had a horrible reaction. He was like dead to the world. He was tired. He didn't feel right. He had like a low grade fever. He had like muscle aches. Like, his was awful. I had to play nurse for a couple of days.
Wait, I have a question, because someone said, and I don't know if this is true or not, and you're a doctor, if you actually had COVID, you will get you'll get sick from it again. Not like you'll get COVID again, but your symptoms will be really bad.
Reaction to the vaccine.
Yeah, a reaction to the vaccine.
So this seems to be a little bit anecdotal, right? We haven't really studied this a ton. What seems to be happening is that those of us who did not have COVID, or at least recently, it's the second shot that we have a bigger reaction to. So the first one is like an appetizer. The second one is like the main course, right? And you get real full after the main course. People who had COVID already sort of had their appetizer, right? They already have some immunity to it anyway. It's kind of like getting the first shot. So then when they get the first shot in their body, it's really actually kind of like the second shot. So then they have a bigger reaction on that first shot than they will actually on the second one.
Oh. And then how do you feel about the Johnson & Johnson? One and done.
Love her.
Listen, I don't trust their baby powder, and I will not trust their water.
Their water? What's wrong with their water?
Oh, I'm calling their vaccine water. I'm sure it doesn't work. Honey.
Stop! This is not for misinformation.
I'm just kidding, everybody. Go get a shot.
By the way, I love that I stand that y'all are all about the right information, right? Not about delivering misinformation. I absolutely love that. Thank you so much.
We believe in that, and we also believe in tarot. So we're up and down, you know?
I'm ready to have my... You know what? Someone tried to read me in New Orleans once when I was like 24. I'm not even...
goatee?
I'm not even right. I'm gonna go. She was like, listen, I can't do this. You got too much going on, baby. Mid tarot reading, she stopped. She was like, baby, she's like, there's too much stuff coming at me, and your cards are a little interesting, and like it's not something that I'm prepared to handle. And she stopped mid tarot. That's the only tarot reading I've ever had.
I would see why you didn't go back. You were like, that is some skeletons I would like to keep.
That's like the time I tried to get acupuncture, and the lady was like, your heartbeat seems like it has a vibration with it that I don't want to deal with. And she wouldn't do me. I left.
Whoa, I know. See,
that's intense.
I know that was really intense. So I've been real curious. I also had, this is very interesting. I know we're getting way off topic, but
That's great.
Someone on a Zoom meeting the other day, we're talking about woo, whatever. Everybody hung up and she was like, hey, James, hang on a second. And then I stayed on and she was like, so I don't know if you know this, but I'm like a low key, like DL, like sort of medium. And she's like, this entire phone call, people have been flying to me to say something to you. And they're all very, very recent. And I was like, what are you talking about? And she's like, there are a lot of dead people who you have interacted with very recently.
Patients?
Who are trying to say something to you. And this was at the end of January, right after like the worst of COVID, where, I mean, I was having 1 to 5 people die a shift. Like it was, I mean, I lost it. It was wild.
Well, let's get into, maybe we should take a break at this.
We need to take a break.
And then we're going to come back we're going to get into the nitty gritty.
Wow.
Woo, you have people in freezer trucks trying to say hi.
Mm-hmm.
Do you want to improve your sleep? Well, listen up and get a Helix.
Whether you sleep on your side, your back, your stomach, Helix makes premium mattresses that are designed to fit your specific sleep style.
You know, now that it's spring, why not upgrade your sleep game and get a Helix mattress?
And you know what?
What?
I can guarantee you that they have a mattress for you with over 20 different styles and models for you to sleep on. I love sleep. I can't get enough of it.
And I love my Helix mattress. So ever since I got the big and tall, I know we go on and on about it, but it's a perfect fit for me. I haven't had a mattress before that I was able to select a model from, and I'm so happy I got to do that with Helix.
And I, too, have the big and tall model, and it's perfect for my big and tall body. I loved it so much, I got a second one from a guest room.
True.
Yes, baby. And the people are sleeping great in there when they eventually do sleep in there.
Best of all, Helix delivers right to your door with free shipping in the US, and you can get 120 night sleep trial to make sure that it's right for you.
You also get peace of mind because Helix mattresses are backed by a limited lifetime warranty and have been recognized by experts at places like Forbes and Wired. And me. I am a sleep expert too.
Period. Go to helixsleep.com/sloppy to get up to 27% off site-wide during their Memorial Day sale.
That's helixsleep.com/sloppy, and make sure you enter sloppy seconds after checkout so that they know that we sent you.
helixsleep.com/sloppy.
Get yourself a Helix.
Okay, something about me. I love shopping. If you love shopping too, you have to check out Rakuten.
And all you have to do is shop, 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 shop. And with Rakuten, you get cash back and rewards on almost everything you buy.
Exactly.
Shop.
Homeware, daily essentials, jeans. We're talking eBay, CVS, and even Levi's.
Ooh, so I can buy a vintage couch, tons of paper towels, and grab a new pair of jeans and still get cash back.
And that's not all. You can even stack those rewards on top of sales and coupons.
But Big Dipper, how does this magic work?
Well, I'll tell you. Rakuten is paid by partner stores to send them shoppers, and then Rakuten passes on some of that money to you, the member.
Rakuten is so real for that.
Plus, Rakuten has 17 million members who are already saving. Don't you want to become one of them?
Join for free at Rakuten.com or download the Rakuten app and start saving money now.
That's Rakuten.com or download the Rakuten app today. We all have days when we want to eat well, but just don't have the time or the energy to plan, shop, and cook.
That's exactly where Factor comes in. They deliver fully prepared meals designed by dietitians and crafted by chefs right to your door.
With Factor, you can stay on track with your nutrition goals, whether that's high protein, balanced meals, or overall wellness, without any extra effort.
The meals are fresh, never frozen, and ready in just 2 minutes, which makes it easy to fit into your routine.
You know, I love coming home after a long day and having a tasty and filling Factor meal. It's waiting for me, and I don't have to worry about shopping. It's quick and easy, and one less thing I need to think about when I get home.
You know, I'm feral for fish right now, and I always get my fix with Factor. I recently had their scampi-styled shrimp and salmon, and let me tell you, it did not disappoint.
So get Factor today and start enjoying delicious and nutritious meals.
Head to factormeals.com/sloppyseconds50 off and use code sloppyseconds50 off to get 50% off and free daily greens per box with new subscription only, while supplies last until September 27th, 26. See website for more details.
That's factormeals.com/sloppyseconds50, like the number, off. Sloppy Seconds 50 off. Okay, we are back. Do you really want to pick up on the spirits?
No,
I mean, we don't
I
have
want
to.
pick
I
up
just-
on when it was at its worst. I have a
Uh-huh.
question because I, as a person who am not a doctor and not in a hospital, I'm speaking to a doctor. When it was at its worst and that everyone was dying, how were the hospitals handling it? Like, how were you handling that every single day?
Whew. It was a lot. Kind of like I mentioned earlier, there's, different hospitals were very, very different, right? So this is why you'll hear a mix of stories. Like some people in healthcare will be like, it wasn't that bad. And other people in healthcare were like, oh my gosh, like I couldn't handle it. So, I signed 17 death certificates in the month of December, which just means I was the primary care provider as a nurse practitioner for 17 people who died of COVID during December. It was almost that many in January. It was rough. It was all the horror stories that you hear about. I'd talk to my physician or other nurse practitioner colleagues, and we would ask each other how their patients were doing, more so we could evaluate what resources were maybe going to be available if unfortunately one of their patients passed. I mean, it was that deep. So, we were, like I said, my worst case, the day that almost broke me. So patients are in the hallways, outside of the ER. We had tents set up in the parking lot. We had patients in the back of ambulances, and then we were still out of room. So we literally had patients in parking spots where we would normally park our cars, and they were just sitting out on gurneys. And this one woman comes out, and she was incidentally COVID positive. So she was COVID positive, but that's not why she was there. She was actually there because it turns out she was having a heart attack. We have to give, if we can't get someone into the cath lab right away to sort of, clean out one of their arteries to stop the heart attack, we start them on a blood thinning medication called heparin. And sometimes we do that as a bridge to the cath lab. And so there was someone already in the cath lab. We could, and it was a small community hospital. We couldn't get her in there. So we had to start a very, very dangerous blood thinning medication on a woman who was sitting in an ambulance gurney in the parking lot. And she sat there for 8 hours. Because there were complications and all these other things and whatever on a blood thinning medication in the parking lot. This was day, kind of afternoon into evening. So at one point it's like 10 o'clock at night when we finally got her inside.
That's horrifying.
And then there's no families around. There's no people around. It's hard to talk to because we can't have families around with COVID, right? And then meanwhile, like this patient's coding and I got to go back over here and we got to do these things and we don't have vapotherms. We don't have ventilators anymore. Like it was some of the decisions we had to make during that time as an organization about how we triage patients was really, really, it was pretty awful.
And then you would open up Instagram and see your gay friends out at the club.
Well, that's why I don't know if y'all saw that video that I was on for Gays Over COVID, but it was one of those days where I lost it. I'm like running around the hospital in my gas mask. You're like literally off and on tears. And then, you see people who are like kikiing in Puerto Vallarta. And I was like, are you kidding me? Like, why? We have to go to Vallarta. So then I don't know what possessed me. I mean, I do videos and I do stuff on Instagram, whatever anyway, but I just possessed me. I was like, I don't know what the hell to say to y'all. Like, whatever. And I put that up, and next thing you know, whoever the mysterious gays over COVID was took that video and ran with it, honey.
Right. It's just, it's such an American ideal to be like, well, it's not happening to me, so I'll keep doing whatever the fuck I want to do.
Mm-hmm.
And what's crazy is, as a person who I feel like I've taken reasonable precaution, and I'm lucky enough during the pandemic, I moved into my own apartment. So it's like, I'm taking reasonable precaution. I'm not being insane. I still will go to the grocery store, go take a walk outside, whatever. Mm-hmm. I'm like, it isn't that, I mean, it's hard, but it's not like I'm not living in a prison cell, sleeping on concrete. It's like, all we're asking people to do is like stay home and wear a piece of fabric on their face. And that to me is the most challenging thing. Because you could just like look at people and you go like, oh, so you just don't think about other people at all.
Isn't it pretty wild? And I think that, there's the mental health aspects of this is really, really important. And I mean, I think it's tremendous to hear you say that, Dipper, because both of your personalities, your work, your income streams, whatever, really involve being around a bunch of other people in small places, right? And making points doing that. Mm-hmm. And the fact that you can still have that, even just if we get down to brass tacks about it being a revenue stream, right? Like that revenue stream, like neither of y'all are performing in clubs. So like that revenue stream is not there. And that yet you can still be sort of a sane, rational human being about like, well, I need to stay home. I need to figure out different ways to do this. And I need to wear a mask. You figure it out. Right. But I think some of that is there are people who just haven't been grounded with whatever in their lives, but also have been getting really bad information. So if you have, and I'm not trying to throw anybody under the bus here. I know some of these people who got thrown under the bus by Gays Over COVID or whatever, but if you have some health professionals out there telling you one thing, and then your sister-in-law, brother's crazy auntie, hairdresser, dog walker, post something on Facebook, and all of a sudden you take that as Bible. And then you're like, oh, well, COVID's not really a big deal. I'm young anyway, so I'm cool. Like, and I need to get out of this house because I've been locked up for 4 months. I'm going to Puerto Vallarta. Well, you might actually be operating from what you think is more of the truth than what actually the truth might really be for you. Right. And so, it's complicated. I am, at first I wasn't for the public shaming. I really wasn't. I thought it was maybe a little bit too intense. Yeah. And then it just kind of like everybody, it really, really impacted me in a really intense way. And then I was like, you know what? People need to be held accountable for their actions.
Drag these hoes.
We're going to move on. But we did talk a little bit about, okay, if you feel locked up and you need to take a vacation, girl, and you've got the money to do so, fine. Don't go to a circuit party.
Yeah, don't go to a club. I was fine with people going to Mexico. Go, rent a house. Have your 10 friends come and stay in that house. And don't leave the house.
I've talked to a couple of people who had to fly or whatever. It's like Delta is still keeping middle seats open. A lot of people said they felt safer flying on an airplane than they do at the grocery store because it's like really important. It's like, so if you want to take that risk, great. It was just when people were there, it was like you literally brought disease to a community and then ran around maskless and went to circuit parties for what? Mm-hmm. Anyhow. All right. We want to talk. Well, actually, we're gonna take a break and then we'll be right back.
Do you know Wicked?
Yes. Oh my gosh. I have my I'm gonna tell you a really quick Wicked story. So this is way back in Chicago days, like 100,000 years ago, when Wicked opened in Chicago. It was like, the first off-Broadway, whatever, they brought it to Chicago, and it was Anna Gasteyer and still Kristen Chenoweth.
The weakest of all the Elphaba.
Yes, the wickedest of all the Elphaba. And that I got to go to that red carpet opening.
Oh,
because the woman who was the costume designer, was getting a divorce, and she was a friend of mine, and she was like, I need some arm candy. And at the time, she was cute and fit. So she took me there, and I got to meet they were filming Jennifer Aniston, Will Ferrell, all these people were filming like The Breakup or whatever in Chicago, some movie that they were in, and they were all there. So I got to meet all these people at this
celeb
big,
sighting.
What a gift!
Honey, that's the only one. And I was a little baby gay in Chicago, and like whenever that was, 100,000 years ago. But it was super fun, and I bawled my eyes out at that show.
Oh yeah,
Thank
no one
God.
mourns the wicked though.
Hello.
But what you find out is that she may not be wicked. Okay, I'll let people get to the bottom of that.
Spoiler alert, 20 years later.
We want to talk about
As
sex
an
now.
MP, would you? Well, I first want to bring up something that happened on one of our previous podcasts. If you were really, really wasted and someone took you home and then you almost had sex and then you threw up a whole bunch, this is just if this happened to you, the next morning, would you make them give you an IV if they were not a doctor? Or
a nurse,
are
right?
you saying, would you be
This
able to
is
talk
real.
me through giving an IV to someone if you were hungover?
Me as a medical professional, talk you through how to do it. Is that what you're saying?
Yeah.
I could talk you through it. The tricky part about an IV is that it requires starting an IV, like the needle in the arm, in the vein. And that's a pretty intense skill that you want a nurse doing, right? Nurses, we are the best at doing that. So
gentle hands.
Me being
But what
the
if I tell
nurse-
you I've tapped for maple out of a tree before? Is it like that?
Are you calling me a tree?
Big sir over there.
Big sir, right. I got some bark for you. So, no, I would not recommend, because here's the thing. You mess around with that needle too much, you poke the wrong thing. You might mess around. I love IVs, by the way, after being drunk. Like if you're in Vegas and you can pay that $250 or whatever for the little IV people to come to your room and get you some hydration after being drunk, I love it. I'm a fan of it.
They have a service that'll come do it here for $150. They'll pull up right to your house.
Love it. Because this is literally how we hydrate people.
That's what that song Tap In is about.
Right. Come on, sweetie. She knows better. That's how we hydrate people in the hospital. So if you're dehydrated from whatever, we literally are starting an IV and giving you a bunch of fluids. And so if those fluids have some little extra whatnot in them, as long as those people know what they're doing and they're like certified to start IVs or whatever, I think it's a great idea.
Well, they weren't.
When you do an IV, the needle is only poking through one side of the vein.
Yep, very good. Think of it like a hose, like a water hose.
No, stop!
And
my arm is hurting thinking about it.
And
then the needle goes in.
Yep, but on top of the water hose, you have like a blanket, which is your skin. So you got to get through the blanket into the water hose, but not through the other side, right? Because you want to either be able to pull some blood out or put something right back into that bloodstream. So the angle that you go in, the depth, when you pull it out, all that kind of stuff
How big is a vein?
I mean, they're pretty big. There are some veins. I got some big old juicy ones here. You got some veins that are the size of like those little thin straws that can be that big. Those big ones, and like that's why we go for this that we call the antecubital space in your elbow here, like the inside of your elbow. You get big ones there.
Sometimes
I can see yours, Dipper.
Sometimes mine really show through, and other days when I get like STD tested, sometimes they're like easy, no problem. They're like boop, and it's like flowing. And then other times I once got stabbed twice in the left and 3 times in the right arm, and she was like, "We're done," and I was like, "I need these test results." I was like, "I'm not coming back another day. You fucked up. Like,
I need you to figure this out.
Phlebotomist in here so we can get it on and popping." Hydration.
It usually has everything to do with hydration. If you're super well hydrated, it's really easy to get those. If you're a little bit dehydrated, for whatever reason, that makes it usually harder.
Meatball, would you say on most days you're hydrated or dehydrated?
I'm pretty hydrated. I drink about 7 or 8 cans of LaCroix a day.
That stuff is not hydrating. The bubbles take out the hydration. It's just
Actually-
refreshing.
Actually, not true. Not true. If you look La Croix, sweetie, La Croix works great. Now, what doesn't work great is like a Diet Coke.
Sure.
All the crap in the Diet Coke. So just know that all the bubblies that you're drinking are not all the same. But if you are like, all our queens are getting paid right now from
Miss Bubble.
From Miss Bubbly with the
Miss
caffeine.
Bubbly. So I don't love too much caffeine.
Trisha Paytas drank a bubbly in one of her
dehydrate you.
recent
But
videos.
this bubbly is great. The non-caffeinated bubbly or the La Croix, go for it, honey.
I actually just
Oh.
ordered a big old case of the caffeinated bubblies.
Get
Oh,
it.
but you just said the non-caffeinated.
Yeah, that's okay. I mean, if you have a couple a day, that's okay.
Well, I'm gonna see if it works like Adderall, and if I drink enough caffeine, it'll help me focus. But you're not a doctor. That's not what we're. Oh wait, yes you are.
She said, I'm just gonna make it work like Adderall. No.
She's
Can
like,
we
I'm gonna
talk about
snort it. Yeah, let's talk about sex.
Adderall almost killed me once. They had me on 100 milligrams when I lived in New York City. I was rail thin, and I was always passing out. Can we talk about
who's
sex?
they? Who's they?
Well, okay, so in Texas, you have to get all these. You have to go see a doctor to get prescribed Adderall, but in New York, you just have to see like a psychiatrist or a psychologist or a mental person, and they'll just give you the number. And I was loving the stuff, so I kept walking in being like, "Can you give me a little bit more? I'm just trying to live."
No.
And she kept giving me more until I was up to 100 milligrams a day on extended release. The XR is popping them 50 milligrams once in the morning, once in the afternoon. Baby, I was crazy. Let's talk. And because I was on so much Adderall, I had trouble getting an erection sometimes.
I'm not surprised by this at all. Are you off all of that Adderall?
Yeah, I
now?
don't do any. I only smoke weed now.
Oh, good. See? Yay for the weed.
Oh, I had to get out of New York. I had a problem. Let's talk about sex.
She's like, that's a different podcast, boo.
Okay, so we love to talk about sex and fucking, and we both have had a lot of wild and crazy times in our life. But now I think what is hard is like, so you're married, Meatball's in a relationship. A lot of my friends who are coupled up or like already, like they have their little like fuck buddy or whatever who they trust in their pod.
Dipper wants to know when he can start cruising again.
Right, because the deal is I have definitely made one or two sort of precaution. Like I took as much caution as I could, but
A little risky takes.
There were some risky moments in the past couple months. I talked about sucking a guy's dick while he wore a mask, and we put up a glory hole as well for double precaution.
Oh.
I told that story on the podcast.
Yeah.
And
Wait, what
so-
was the other times? You haven't told me any other times.
Well, no, back in December, there was like a guy who I was like I like saw on multiple occasions, and we sort of had a conversation, and then both went and got tested and then didn't see anyone. And then we like hooked up for a few weeks.
And that's the way to do it. I was going to say, particularly if you have messed around and found you like a really good buddy who the sex is really good, and they're sort of like being generally responsible with things. I've been telling people through this entire time, do that. Like the anticipation will also make the sex really great.
Right.
But also if you know that this person, if you've maybe had interactions with them before and you're like, damn, that sex is really good. Like be really open about this and be like, hey, like the last time we got together was mind blowing. And here are the 17 things I want to do to you. I went and bought a toy, like whatever. So I'm going to get tested. I'm going to isolate my butt. And I mean, isolate my butt.
Right.
For 10 to 14 days, plus or minus. I'm going to get tested again. And when that second negative test comes, so am I.
Right.
To your house, right? Like we have to operate in a little bit different way than we did before if you are able to do that. Now, listen, there are a lot of people out there who like can't work from home. They couldn't necessarily always isolate, like all those things. So then what you said, I mean, that's literally the New York City Department of Public Health was recommending what you said. They were literally like, all right, we know y'all gonna make it do what it do. So when you do, don't kiss, wear a mask. Right. If you can, put up some sort of barrier that will allow.
Okay. What kind of barrier? Is a bed sheet with a hole gonna work, or do we need maybe cardboard?
Well, girl, that's like, I mean, that's the thing. When we had that, we like put that bed sheet up. I was like, this is not doing anything.
not
a
really.
Big ass glory hole.
Right. I mean, it kind of helps, right? It'll stop some of the bigger droplets per se. But
Right.
let's say if that person is wearing a mask and then there's a bed sheet up, okay, like, all right, and then you do the glory hole. Awesome, go for it. Listen, we are sexual creatures.
And we
have
are
to-
sexual creatures. Now, does the COVID live in the cummies?
So what the studies are finding is that it does, but it probably is not in an amount or as an intact virus in order to cause infection. So I really like
my
to.
baby isn't going to get COVID.
You're like my babies. So I really like to remind people of this. So, when, like, for testing, for instance, people will be like, well, I got COVID, I got over it, but I'm still testing positive. So the COVID test, I like to use this car analogy. So you come up on a driveway, and in that driveway, you see a steering wheel, a seatbelt, and a tire. But that's it. Well, you can pretty much surmise at some point there was a car in that driveway, right? The test is looking for parts of a car, and that test is going to be positive. It's going to be like, you're COVID positive. Well, you're not COVID positive because there's not an intact car to drive, and to have active infection, you have to have an intact car. So the test is just looking for pieces of the car. Same thing where we think anyway. Same thing with how we detect SARS-CoV-2, the virus that causes COVID, in semen. We can detect it. We know it's there. It doesn't mean it's an active infection that you're going to be able to pass COVID onto someone if they swallow your semen, let's say. That does not happen.
But
Now,
what about
does it
the
live
butt
in the
stuff?
butthole?
Yeah, because I heard fecal droplets, fecal matters.
Well, you should be douching before you go back
But
there.
that doesn't get, if you know that you interact with some
does
fecal
douching
matter.
get most fecal matter out, Mr. Doctor?
Depends on how you do.
I mean, well, it does depend on how you douche.
How you douche?
I have some thoughts about how you douche too. But
with Listerine?
I mean,
I'm just kidding.
there are microscopic.
No, but just a little bit gives you that tingle and it tastes delicious. I'm just kidding. Don't do that.
just a little tingle. There are microscopic fecal particles that you're never going to get rid of, ever. Right? This is why
I told you, Meatball, you have a dirty butt.
Well, this is why the official recommendation is that when you are performing analingus, you should use some sort of
Rim
barrier.
job.
Now, we all
Right.
know that nobody uses a barrier, but this is why I actually am somewhat of a fan of these, like, what's their name? The coffee scrub people.
Oh, the butt, look for cleaning your butt.
Like you should not use it as often as they say. You don't, it can be dangerous. It can actually open up like microscopic holes in your anus if you start to do that too much. But occasionally doing that is actually really good. Now, to answer your question, yes, we can detect SARS-CoV-2 in fecal material, but it's the same thing. We can detect that it's there, but it's not like an active infection that you can get from that. There are lots of college towns, particularly, I think, Lansing, where Michigan State is.
Where
Actually-
eating ass is very popular?
Where eating ass is very popular. They
But the dental
tested
dam is in full stock on the shelf. No one's getting the dental
in
dam.
Michigan. No, they tested their sewer system from the dorms to see how much of, like, as a percentage of stool had SARS-CoV-2, the virus that causes COVID, in it. And that's how they could tell what level of infection were there on their campus. Isn't that wild?
Wow. They took
We
it straight to the
really-
shit. Well, how do you get a... I don't want to ask about them digging around a duty.
Don't.
It's much cleaner and more scientific than you're imagining, probably. It's a whole thing.
Well, that is, I guess, enlightening. It is so interesting. I mean, I think my biggest issue is, like, I really enjoyed casual sex.
Yes.
Sort of when things were open and available.
Ooh.
And so when last year, when things shut down, I was just like, oh, well, I have sex in a very casual sort of like whatever way. I'm not going to be doing that now. So we're done. I know so many people who are like, they are more monogamous people. They have been actively trying to date, like meet people and like do a bunch of Zoom calls and then make a decision. Are we going to meet in person? Will we take these precautions?
Well, you know, that worked out for Ross Matthews because they started dating at the beginning of the pandemic long distance and now he's engaged to a doctor.
What? I didn't know Ross was engaged.
He's engaged. Yeah, he was on Entertainment Tonight. I'm very excited for him.
Wow.
I just think I think digital dating is like so wild, but I understand like going through it and being as open and honest as possible. I just think it's interesting that people have created like a sex life that is the opposite of that.
They're like jerking off into his Zoom.
Well, no, I mean like the creation
come
of
off
like
the screen.
and like an anonymous vibe, like the more like sex party anonymity cruising. Like a lot of people, learn behavior. So after you do that for a long time, there's no other way that they know how to have sex. And so then it's like causing people to participate in more risky behavior because, girl, on these apps, the amount of people who are like, this is my hotel room, I'm waiting for loads, I already have 4 loads in my ass, come dump, like, boop, boop, boop. And you're just like, oh, that's still happening right now.
Yep. And
Wow.
I feel like the hotel room come dump thing is like sort of if I think about this from a COVID standpoint, and I'm not
How much cum would it take to be full up to get cum or COVID?
How many
from
loads?
How many? And I'm not
or
advocating.
If you ate it, would it mix with the poopy particles?
I mean, I'm just saying. I mean, no, don't. Okay. Whew. Meatball just taking me there. So
she's taking all of us there. She's been up since 3:30 this morning.
It's 3:00 in the morning. So from a COVID standpoint, if someone is coming in, if you're face down, ass up, and someone comes in and make it do what it do, and there's no kissing, there's probably very little droplet exchange, at least like respiratory droplet exchange.
Right.
If that person topping you maybe is wearing a mask. You're wearing a mask while you're laying on the bed. From a strictly COVID standpoint, it's fairly COVID safe. I mean, you're obviously not 6 feet apart, but your faces and things are 6 feet apart. And if you're wearing a mask, like if you're literally going by the COVID guidelines, again, I'm not advocating this. I'm not saying people
right.
should.
No, but it's an interesting conversation.
Well, doctor said, ass up, everyone.
No.
Just after he said, I'm not advocating.
I'm not advocating, but Meatball putting words in my mouth. But I mean, what it does, of course, like I did my research literally on like HIV prevention, right? And,
right.
And I, having been a very active part of the leather community when I was younger, and I'm a very sex positive person, like I'm not a judgmental sort of medical provider at all. We know that people are doing these things.
Right.
It does take me to this other conversation, which maybe that's for another podcast too, about like the whole great PrEP is amazing and wonderful and awesome and everyone is on it, but now we have
like, super gonorrhea,
super syphilis, like chlamydia is wild, and there's so many people who are asymptomatic with those things, and they can
chlamydia wild,
herpes, HPV, like we're 8 times more likely to be prone to anal cancers as gay men because of the HPV and the herpes that we pass back and forth. Like there's all these other things that I'm like, I love hot, like bareback sex, like the next gay, right? Like who doesn't? But I get to do it because I was married and we is monogamous, right? But that's what I've chosen, and my husband and I do that. I'm not saying that that's right or better than what other people are doing. I just really want people to continue to sort of advocate for their own safety while also doing the sexual things that they want and need to do to feel sexually like gratified. And I think we can find that balance.
Right. Because it's all about education and people sort of understanding whatever risk they're taking. And we talked about this many moons ago when we had a guy on the show who has silicone pumped in his dick. And I always bring this back up because we talked about that can be incredibly dangerous. And I sort of equated it to people who still actively smoke cigarettes. They go, well, it makes me feel good. I like it with my coffee. I understand whatever risk this is. I understand that people die from this, but yes, I'm going to puff on a cigarette. And they make that decision. And I think it works across the board. If there's information out there that you understand what the risk is, it's up to those people to take the risk. The problem is,
but just like COVID, there's also probably a lot of misinformation and a lot of people being like, let's inject your dick with this. It'll be great.
Correct.
No questions. No one's ever died.
But the biggest thing that
unfortunately people have died from that, right?
Yes.
Right. But the biggest thing, just to like round out the point, is that with mask wearing, you're affecting other people versus making the decision to not wear a mask only affecting yourself. And that's what I hate, because you can do whatever you want. If I will hate that you did it, but if you want to go to a circuit party, you can do that. I'm going to think you're dumb for doing it. But you don't have the right to be in the grocery store with everyone wearing a mask and screaming, I have COVID, I'm not wearing a mask, and you all are a sheep.
Right. Yes. And that's those conspiracy theories, the misinformation. Like, this is why I literally am building a career on social media and information on social media, while at the same time, I feel like social media is one of the absolute worst places where people get their information. And it has caused so much of this, and so much of this, are we surprised? You mentioned it before, like it's a very American thing. And I suppose that's spreading all over the world too, that people being like very me centered and me focused about this. But there's absolutely so many psychologists and really, really, really smart people have really delved into why this pandemic has really driven so much of this me focused culture. And there really is something to be said for being able to think empathetically, like outside of yourself, for your community and for others. And it has really shown us those who are able to do that and those who are not.
Very much so.
Very much that. So in closing,
yes,
the ideal sexual situation to not get COVID
is just everyone
that you're
wears a
not
mask,
promoting, but I'm just going to set up a scenario.
and dicks in my mouth.
So you're in a hotel room. Someone will be ass down, but they will have taken the bed ass up, face down, wearing 2 masks.
Okay.
And a visor, even though you don't look at them, just for safety. And then they've taken the bed hotel comforter and somehow hung it over the ceiling. So all that's hanging out.
Yeah, you hook it into the sconces.
Yeah, over the sconces and then over your back like a little tent. And then you walk
not over the back. You cut a big hole and you push your butt through the hole.
No, because you'll never get that money back. You know what I mean? They're going to charge you for that.
I want my deposit.
So it's draped.
It's draped.
And then you walk in and you're in 2 masks and a visor. It's probably okay to fuck.
From a COVID standpoint, I mean, I would say yes. Like, I might get in a lot of trouble for saying this, but I mean, we know that people are going to go to the lengths to have the sex, and we have to be really honest and open about that, and make sure that people have the information they can have to be safe. So we've been talking about barriers, right? We were this big old virus that shut down the world, and we were like, well, we can actually make it go away if everyone wears a piece of cloth over their face. So what you're saying here is, if you're wearing cloth over your face, you got cloth draped over your ass, your mouths are your respiratory orifices anyway, your mouth and nose are as far away from each other as possible, and you just need to make it do what it do between an ass and a penis. You actually have not created the worst scenario on earth. What about
now? Wait, what if it gets worse? What if right as you enter him, I pop up from behind the sofa in the corner and I say, hi, this is Chris Hansen. What are you doing here?
You say gays over COVID. What I will say though, she said, I got your ass. What I would honestly say though, and this is going to, for the record, so people who are going to drag me after this podcast, for the record, I will say that we are all super, super close. We are like 30 to 90 days from everyone being doubly vaccinated, like fully vaccinated. So get you one last toy, watch one more porn, try that other masturbatory technique that your girlfriend told you about that you haven't tried yet. Like
Daddy Will on
OnlyFans.
Yeah, exactly.
Yes, see all of those. Yes. Commit to that $6.99 a month for that one on OnlyFans you didn't want to watch, but now you really want to watch it because it's a little kankier than you're used to. Like,
yeah,
do
and
whatever
he's kind of a bitch at the club, but you're still hot, so I'll watch your pornos.
Right, because when we're fully vaccinated, in let's say May, June, like in Pride Month, we might be having a completely different conversation about the type of sex that is safe for people to have from a COVID standpoint. We're so close right now. Just hold tight, everybody. That's
I wonder if I could try to ruin LA Pride again this year.
Okay.
Did you ruin it before?
We gotta stop this.
All right. Okay. Thank you so much. This has been so fun.
Okay.
Thank you for coming. Why don't you tell everyone where to follow you on Instagram so they can watch all your vid?
Yes, I am at Ask the NP. Ask the NP as in nurse practitioner on Instagrams and Twitters. And man, I'm not doing the TikTok. I
Oh,
keep
don't go over
trying,
there.
But I don't, whatever. So
It's hard.
Watch TikTok like it's my job as I'm trying to fall asleep, and I scroll forever, and it's horrible. But I've never made one.
yeah, I mean, these kids are on it. And they had TikTok docs on Good Morning America the other day. I was like, all right, TikTok docs, that's too much for me, Henny.
That's too much.
Right. Ask the NP. And thank you all so much for having me. I really appreciate it. Always a blast. I love doing my annual checkups with the two of you.
Yeah,
Thank
we love
you.
it too. Maybe we can do a physical next time, and you can point out all the things that are wrong with our
Oh
bodies.
my God, that should be our next live show when we're actually live. You should give Dipper a little physical, stick a little fingy up his booty hole.
Oh my God. I would love it. Let's do a prostate exam on Big Dipper to
Yes!
teach everybody
It's
that
a mess back there.
Truly.
She said it's been a year, honey.
Honey.
Well, thanks so much for listening to Sloppy Seconds. You can follow us on Instagram at SloppyPod. You can send us an email to sloppysecondspod@gmail.com or call with a fuck talk story too.
213-536-9180. Follow me at Big Dipper Jelly. Follow Meatball at Spiciest Meatball on Instagram and Fat Drag Meatball on Twitter. Don't forget to subscribe so you don't ever miss an episode, which come out every Tuesday and Friday. Thank you so much, James.
Thank you, James. A doctor. Doodle-doo-doo forever dog. To listen to Sloppy Seconds ad-free and 1 day early, sign up for Forever Dog Plus at foreverdogpodcast.com/plus.
Sloppy Seconds is produced by Forever Dog and Moguls of Media, a.k.a. Mom.
Hosted by Big Dipper and Meatball. Music, editing, and sound design by William Pitt.
Executive produced by Willem Belli, Alaska Thunderfuck, Joe Cilio, Brett Boehm, and Alex Ramsey.
Our artwork was drawn by Christian Cimarroni.
And our theme song was written by Mike Malarkey.